Hello everybody, welcome to this sample video from Dr. Polizio Gatto's Guide to Biostatistics and Epidemiology for Medical Board Exams. For the full video course, please visit drpoliziogatto.thinkific.com here, as well as if you just want the ebook, it's also available here. The link is written here, and you can contact me on drpoliziogatto@gmail.com. This is a high-yield simplified crash course in everything evidence-based medicine for your alphabet soup medical exam, whether it's MRCP, USMLE, AKT, etc. And let's go on and see what we're talking about today, which is relative risk and odds ratio. So again, this is just the contents of what's covered in the full course, and we are here today: odds ratio and relative risk. Commonly tested, very high yield topic, so hope you find this useful. All right, fine. So ignore what's written here for the moment. Remember, we've got different types of studies, right? It starts from a case report. So these are like quantitative studies, right? But there's quantitative and then there's qualitative studies. At the moment, we're discussing quantitative. I've got more of this on the course, qualitative and quantitative and the difference. But anyway, case report, and then you've got case series. And then you've got a case control, and then you've got your cohort, and then you've got your randomized trial, right? So remember, case report is just one case. Case series is a collection of the same case. A case control is basically where you start from the outcome, you go backwards to find the risks, right? So you start from lung cancer, and you go backwards and you find how many of those people who have lung cancer were smoker versus non-smoker, as opposed to cohort, where it's the opposite. You start from smoker and you go this way. You see how many smokers versus non-smokers develop lung cancer as an outcome, right? So that's a key difference between a cohort and a case control. So it's important because depending what type of study the question is going to be asking, it will determine which test you're going to do. So for a case control, you're going to do odds ratio, right? And remember, case control, again, you're starting from the outcome, and then you're looking backwards, looking for the exposure or risk, whatever you want to call it. So for example, you're starting from lung cancer and you're working backwards to check if smoking was an associated risk factor to develop this outcome. On the other hand, a cohort study, we're going to do relative risk, right? So odds ratio, case control, cohort study, relative risk. All right, and then again, remember, cohort study, you're starting with the risk or exposure, and then you're working forwards in time to check how many develop the outcome. For example, smoking, following these patients up over time, see how many develop lung cancer. All right, and then how you calculate an odds ratio versus relative risk is given by two different formulas. Again, just have to memorize this. For relative risk, it's A over A plus B divided by C over C plus D. Odds ratio is A over B divided by C over D, which, if you work out the maths, is essentially AD over BC. Essentially, 1 is your point of no effect. Greater than 1 increases odds, or risk less than 1 reduces risk or reduces the odds. So what does this actually mean? Let's look at the next slide. So knowing how to draw these 2x2 tables is crucial to most of these questions, whether you're looking at numbers needed to treat, relative risk, or sensitivity, specificity testing. You just have to be very comfortable in knowing how to draw these 2x2 tables. So we'll walk through it and how to label them. So remember, when you're drawing these tables, what you want to know is your outcome is going to go up there, and then your risk or your test is going to go on this side. So meaning, if your test is positive, right, or risk positive, and then here you're going to have your outcome positive. So here's going to be obviously outcome negative. Here's obviously going to be risk negative. So for example, if you go back to our table up here, if the outcome is present, so example, disease is present, let's use lung cancer. And for exposed, let's use smoking. Right? So lung cancer present, smoking present, that is A. Right? No lung cancer, but was smoking, that is B. Right? Disease present, not exposed, meaning lung cancer present, but non-smoker, that is C. And the outcome absent, meaning no lung cancer and not exposed to smoking, that is D. Once you've got this down, then it becomes quite easy. If the study that you're looking at was a cohort study, you have to calculate the relative risk, and it's given by the formula, remember, A over A plus B divided by C over C plus D. If on the other hand, the study was looking at the odds ratio, I mean, if it was looking at a case control study, then you'd have to do an odds ratio, which is given by AD over BC. All right, let's look at an example to see how this works. Fine, so here we're given a 2x2 table already, and our outcome up here is heart attack, right? And our exposure, our risk is aspirin. Fine, so we don't know whether this question is asking us to calculate the relative risk or odds ratio. Say the question was asking us, you look at 500 people, 250 people were given aspirin, and then another 250 no aspirin. Then you follow them over time to see how many developed heart attacks, right? So this is an example of you're starting from the risk and following them up over time. So meaning to see an outcome, this is an example of a cohort. If on the other hand, you're working backwards, you're starting from heart attack, and then you're working backwards to see how many of these patients were on aspirin versus no aspirin. That's an example of a case control, right? So once you've got that done, it becomes quite straightforward and easy to calculate these questions. These are those free mark questions. Fine, so what can we conclude from here? 30 people who had aspirin had a heart attack, and 30 people who had 70 people who were taking aspirin had no heart attack. 50 people who had no aspirin had a heart attack, and 150 people who had no aspirin had no heart attack. So if you're asked to calculate the relative risk, remember just putting in the numbers, and remember we said relative risk is given by A over A plus B, and then C over C plus D, and you have to just memorize this formula, guys. So 30 over 100, right? So let's make this cleaner. So A is our 30, and then A plus B is 30 plus 70 over 100, divided by C over C plus D. C is 50, D is 150. 150 plus 50 is equal to 200. Plug in the numbers, you get 1.2, right? So 1.2, remember we said 1 is our line of no effect, so meaning we've got a 20% or 0.2%, so a ratio of 0.2, which is equal to 20% increased risk of heart attack in aspirin users versus non-users, right? So that's what our study showed, right? Doesn't mean this is what the reality is. It's just what our study showed, that aspirin actually increased your risk of getting a heart attack compared to those who were not taking aspirin. All right. Now, suppose you're working backwards. Our outcome first was heart attack, and we went to see, going backwards, what are the odds of those people who had heart attack, they were on aspirin. For that, we have to do our odds ratio, and remember we said this is given by AD over BC, and we get 1.29, right? So how you interpret this? The odds of heart attack among aspirin users was 1.29 times odds amongst non-users, or 29% increase odds of you being on aspirin and you having a heart attack. All right, so they sound very similar, but they're a bit different in how they're calculated and what they're actually asking. Let's look at another example. Fine. A study is conducted to evaluate the association between smoking and lung cancer. Fine. So immediately we know, we put our outcome at the top here, which is going to be lung cancer, positive or negative, and then smoking. We know smoking is our risk factor, positive, negative. Fine. So among 1,000 smokers, 150 developed lung cancer. So we know our total of smokers were 1,000. And then 150 of these guys developed lung cancer, right? So lung cancer positive, smoking positive, 150. And among 2,000 non-smokers, right? So our total number of non-smokers, which is non-smoker, right? 100 developed lung cancer. So non-smoker, but developed lung cancer, 100. So just fill in the blanks here. It's going to be 850 here, right? 1,000 minus 150 to give you 850. 2,000 minus 100 to give you 1,900. Fine. Using this data, what is the relative risk? So we're asked to calculate relative risk. So remember, it's going to be A over A plus B divided by C over C plus D. So meaning this is A, this is B, this is C, this is D. Plug in the numbers, you get 3.0, meaning conclusion is that smokers have 3 times the risk of lung cancer compared to non-smokers. All right, let's do one more. A 64-year-old man with a history of type 2 diabetes and previous coronary artery disease asked his physician whether taking vitamin E supplements, fine, so that's our risk or our exposure, vitamin E. So let's put that down there. Will reduce his risk of future cardiovascular events. Fine, so our outcome is cardiovascular events. Fine. The trial included 9,380 patients, so that's our grand total, randomized to either vitamin E or placebos. Fine, so vitamin E positive, vitamin E negative, cardiovascular event positive, cardiovascular event negative. The results are the 5 years as follows. So we've already been given this table, but essentially, if you are not given this data, you should be very comfortable in drawing this out, right? So total is going to be 9,980, but in this case, we are told what our numbers are. 772, that's our group A, B, C, and D. So 772 people on vitamin E had a cardiovascular event, while 3,999 people on vitamin E had no cardiovascular event. Similarly, for those who were not taking vitamin E on the placebo, 716 had a cardiovascular event, while 3,903 had no event. Given this, what is the relative risk? So remember again, if you're asked to calculate relative risk, it's going to be A over A plus B divided by C over C plus D. And if you're asked to calculate the odds ratio, it's going to be AD over BC. So remember, guys, be very comfortable in knowing how to draw your 2x2 table. Put your outcome at the top there. Put your risk on the other side, right? And then know what goes where. A, B, C, D, right? Not A, B, C, D. It's A, B, C, D. And once you've got this down, it becomes quite easy to answer these questions on relative risk or odds ratio. Fine, so we've just explained this. And we're done with the topic. And our cat of the day is the African savanna cat. So this cat is a stunning hybrid between the domestic cat and the wild serval cat. It looks athletic. Almost looks like a cheetah, doesn't it? Just missing the black lines down there. Very tall, athletic feline with a spotted exotic appearance and very intelligent. Again, can be taught how to play fetch and, almost like a dog, really. You can walk them on a leash also. Very agile, can jump over 8 feet. Look at that. Quite an active cat, so they get bored quite easily, so they need to require a lot of stimulation, otherwise they'll get quite bored and destructive. All right, but then as you can imagine, due to their partial wild ancestry with the African serval hybrid that they are banned in some countries. All right, guys, thank you for watching this video and hope you enjoyed it.